Okay, this is ALHS 1011, and in this session, we will be talking about a chapter from Module 4, and that chapter is the blood chapter. There are two chapters on cardiovascular system, the first being on blood, focusing on blood, the second focusing on heart and blood vessels. So this chapter is the first one on blood. And here are some of the standards and the learning objectives you would need to know. Okay, so what is blood composed of? Blood is basically plasma and what we call formed elements. So it's essentially plasma and then everything else. Formed elements are sort of everything else. And plasma is over half of blood. If you look at this vial of blood, it's been centrifuged down. 55% of total blood is blood plasma. And it is yellowish, it is straw colored, it's not red. 91% of that plasma is water, with another 7% being proteins, 2% being ions, nutrients, waste, gases, and regulatory substances. So most of it is water. In some of the plasma proteins that are very, very important, dissolved in the plasma, include albumin. Albumin aids in fluid balance and transport. Fibrinogen, which is a substance that we require for clotting, and globulins that protect us from infection. When we say that something is blood serum, that is talking about the plasma with fibrinogen and clotting factors removed. So if you take the clotting factors and the fibrinogen out, that is blood serum. Okay, so blood is 8% of our body weight. Everything else is 92%. And you could see in this picture, this graphic, that again, plasma being 55%, we have a buffy coat, and then formed elements. And then if you extract just the plasma, most of it, 91% is water. And then the proteins, the 7%, are comprised of albumins, globulins, and fibrinogen. And then you have some other solutes. Okay. As far as the formed elements, the remainder after the plasma, much of it is red blood cells. Then we have white blood cells. White blood cells consist of neutrophils, lymphocytes, monocytes, eosinophils, and basophils, and platelets. So we talked a little bit about plasma. Let's dive into formed elements. I mentioned that the majority of the formed elements are red blood cells giving blood its nice red color. And then you have platelets, which are for clotting, and 5 different types of white blood cells. And you can see how they even look different. So erythrocytes, erythro meaning red, are the red blood cells. And they're these nice biconcave, they're not a donut hole, they don't have a hole through them, but they have a crater on each side. And they're created through a process called erythropoiesis. Poiesis means formation or creation of red blood cells or erythrocytes. And this happens in the red bone marrow. These cells do not have a nucleus, so they do not reproduce themselves. They're sort of donut, I said, but not totally, no hole, biconcave, and they live about 120 days. Your leukocytes, so we call them white blood cells. Leuko meaning white, white cells site. These are the guardians from invasion and infection. And some of them are polymorphonuclear and some of them are mononuclear or one nucleus. So your neutrophils, your eosinophils, and your basophils are the monomorphonuclear granulocytes. We call them granulocytes because they have those little dots in them and they're granular. Your monocytes one nucleus. Polymorphonuclear granulocytes are made in the bone marrow, but mononuclear are also made in the bone marrow, but end up maturing in lymphoid or myeloid tissue. Okay, your polymorphonuclear granulocytes. There are three types. You have neutrophils, which are the majority, 60 to 7% of leukocytes or white blood cells are neutrophils. They're the most aggressive. So when bacteria attempt to destroy tissues, they go into action. They use a process called phagocytosis, or eating or swallowing, and release lysosome. I think of lyso, like to destroy, like Lysol kind of cleans up, germs. That's an enzyme that kills and destroys bacteria. So if an infection is to occur, then the body, a blood value would have a higher than normal number of neutrophils, right? Because those are activated, they're in action, doing their job. Eosinophils are less, they're 2 to 4%. And those come into action when there's a parasitic invasion. They also neutralize histamine in an allergic reaction. So they're going to what that means is they're going to calm down an allergic reaction. Okay. Your basophils, there are a lot less of those, 0.5% to 1%. They're involved in allergic reactions, inflammation. They secrete a chemical called heparin and prevent our blood from clotting. They also secrete histamine, which dilates blood vessels. Wait a minute. So basophils secrete histamine, causing kind of the symptoms that we get from an allergic reaction, and eosinophils kind of calm that down. They neutralize that. If a basophil moves into a tissue, then we call that cell a mast cell. Okay, our mononuclear agranulocytes, so no granules, one nucleus. 3 to 8% of these are white blood cells. These are the largest, slowest ones to arrive. This, if there's a chronic infection, this would be a higher than normal value. It also uses that Pac-Man action, phagocytosis. And if these move into tissues, we call them macrophages. So the basophils become mast cells if they go into tissues. If a monocyte does, then we call it a macrophage. And then we have lymphocytes, which make up 20 to 25%. These are the smallest. And we have two types that we'll talk about in depth. T lymphocytes that attack and destroy pathogens directly, and B lymphocytes, which produce antibodies. Okay, thrombocytes. So thrombo means clot, cyte means cell. So this is clotting cells. We commonly know these as platelets. And that's what platelets do. They help with clotting. They are the smallest formed element. They are responsible for blood clotting. They cause vasoconstriction. They secrete clotting factors. They make platelet pools. They attract neutrophils and monocytes, which again help destroy bacteria. And they release serotonin. Serotonin is a feel-good neurotransmitter. So this can cause the smooth muscle to constrict and decrease blood flow to an area of injury. So we want vasoconstriction. We want the blood vessels to tighten, clamp down, get smaller, because we don't want to lose blood. So thrombocytes are awesome because they constrict the blood vessels. They attract white blood cells that will help us with preventing infection. They cause plugs. And they are help with clotting. Okay, so hemopoiesis. I mentioned before that poiesis means formation or beginning of, and hemo is blood. So we have a few types of hemopoiesis. Erythropoiesis, erythmo meaning red. The liver and the kidneys secrete something called EPO, which is a shortened name for erythropoietin. And that erythropoietin stimulates the red bone marrow to make red blood cells. Leukopoiesis, leuko meaning white, stimulates colony stimulating factor, which causes us to make white blood cells. And thrombopoiesis creates thrombocytes. It causes the liver and the kidneys to again secrete something called thrombopoietin to increase the number or create thrombocytes. Hypoxemia. What does hypoxemia mean? Well, hypo, low, oxy, oxygen, emia, blood, low blood oxygen. This is caused by disease, elevation, exercise, blood loss, or carbon monoxide. So what happens here is there's hypoxemia, not enough, for whatever reason, not enough. This is sensed by the kidneys. The kidneys secrete EPO or erythropoietin, which stimulates the red bone marrow, which accelerates erythropoiesis, which makes more red blood cells, which increases the count, which can then transport an increased amount of oxygen and fixes our hypoxemia situation. Here's a picture of stem cells. So this would be a generic hemocystoblast. Blast means embryonic cell. So blood cell embryonic is basically what that means. This is a generic stem cell before this blast turns into more specific. And that's how it kind of happens. It, in various stages, changes to what it's going to ultimately become, either platelets or white blood cells or erythrocytes. Hemoglobin. Hemoglobin is very important. Hemoglobin literally means iron protein. And this is what hemoglobin looks like. It is 33% of a red blood cell is hemoglobin. It carries H ions that acts as a pH buffer. Okay. So when when hemoglobin is carrying oxygen, we call it oxyhemoglobin. And when hemoglobin is not, we call it deoxyhemoglobin. So sometimes red blood cells are bright in color if they have oxygen, and sometimes they are dark in color when they do not. So hemoglobin, heme, blood, globin. Globin is a protein made up of amino acids. Heme is made of bilirubin and iron. And bilirubin gets excreted from the body in bile as feces or in the blood eventually as urine. To have erythropoiesis be successful, we need to consume by diet iron. So iron can be found in meat, eggs, vegetables, and legumes. We need folic acid and vitamin B12. B12, we can find these things in orange juice, meat, dairy. Also, we need copper and vitamin C. So again, the meat, the fruit, and the green vegetables. The colorful diet. Okay, blood clotting. So the cardiovascular system is a closed system. We're not leaking blood at any given time, hopefully. And it's pressurized. It's maintained that pressure within the vessels through blood pressure. If a break or a leak in the system can't be stopped, you'd lose a lot of blood. So let's talk about what happens when there is an injury to a blood vessel. So we want hemostasis to happen. This would be the first stage. Stasis meaning staying still, standing still, staying still. Hemo meaning blood. So we want the blood to stand still in order so that a clot could be formed. So hemostasis prevents blood loss. That's why we hold pressure on a wound. And there's a chain of events. So first thing, when the inner wall of a blood vessel is damaged, an underlying collagen fiber becomes exposed. Platelets that are floating around in the blood anyway begin to attach to that rough, damaged site. The attached platelets release chemicals that kind of call their friends. Hey, come on over, I'm having a party. I'm making a platelet plug. So they gather more platelets to try to form a platelet plug. Meanwhile, the blood vessel, remember that serotonin causes vasoconstriction, causes the blood vessel to spasm, decreasing. So let's not bring a whole lot of blood over to this wounded area. Well, we don't want to bleed out. We're trying to form that platelet plug. So within 15 seconds, blood clotting, or what we call coagulation, starts to begin. Okay, this gets a little fancy for our taste, but it gives you an idea of that blood factor. We call it a cascade reaction. Different blood clotting factors get activated to help form a clot. So calcium ions, and remember those plasma proteins, we had albumin, we had globulin, a chain reaction starts to happen. There's chemistry that happens here. And one of the most important proteins, clotting proteins, is prothrombin. And that gets produced by the liver with the help of vitamin K. And that gets converted to thrombin. So pro meaning forward gets converted to thrombin. Thrombin gets transformed. It transforms fibrinogen, which is already a substance in the blood, and converts that to fibrin. And fibrin, I always think of like fiber, like cereal, like mini wheats or something with the fiber. Fibrin becomes like insoluble hair-like mesh. And that fibrin forms a net-like patch, that mesh, at the site of the injury. It snags more blood, it snags more platelets. And within 3 to 6 minutes, we're making an actual clot. So we go from platelet plug to clot. Okay, once we have a clot and we're out of danger of bleeding out, then the wound begins to retract. It pulls its edges together toward the damaged tissue. It's trying to close it off. These edges need to regenerate epithelial cells to make a permanent repair. Eventually, that clot is going to need to get dissolved and be no longer needed. So we have an injury, we have damage to the blood vessels. Platelets secrete clotting factors and call more platelets over to form a platelet plug. And then we have vitamin K and calcium and prothrombin, which takes our thrombin and fibrinogen and forms fibrin, or this mesh-like substance, a net. And that fibrin net becomes the beginning of a clot. So sometimes we don't want blood clots. And sometimes when a vessel is repaired, sometimes an inactive enzyme called plasminogen gets converted to plasmin. And plasmin will help us dissolve unnecessary clots. So we don't want a clot in our brain. We don't want a clot in our heart, in our lungs. So fibrinolysis is the process of breaking down clots. So clots that we don't want. Lysis, I always think of destruction, Lysol, breaking down. So we want to convert that plasminogen to plasmin, and that plasmin is going to help us get rid of any unnecessary clots. Okay, so I mentioned this, we don't want it in the heart. So sometimes clotting can happen, and we call a clot a thrombus, and it can form and wedge and lodge in our coronary arteries, causing a heart attack or a myocardial infarction. So that clot, it sticks to that rough surface, and it can form a thrombus. And if it blocks off a coronary artery, it can become a heart attack. Sorry, this one's hard to see. When a clot, where the clot forms matters. So where we don't want a clot, we want a clot at a wound. We don't want to bleed out. However, we don't want the myocardium. We don't want the heart muscle to be clotted off. If that thrombus, which you saw in the previous picture, breaks off and travels, so a moving thrombus is called an embolus. It can get stuck, lodged, wedged in a smaller vessel, blocking the blood flow. And if that happens to the head, it's called a cerebral embolus, and that would cause a stroke. If it happens to our lungs, it's called a pulmonary embolus, and that would be, we call it a PE, or pulmonary embolus, and that would affect our ability to oxygenate. So these are clots that we don't want them certain places. So there are ways to prevent and treat blood clots. There are platelet repulsion medications that are chemicals that prevent the sticking of platelets. There are anticoagulant medications. Coagulation, remember, means blood clotting. Aspirin, usually people take an 81 milligram or baby aspirin, heparin, Coumadin. Those things can be, we call them, somebody's on a blood thinner. That just means anticoagulant. That prevents unnecessary clots. Sometimes if a clot is made, we can give clot busting drugs called, a lot of times they're streptokinase, and that will dilute the thrombin. So it'll dissolve a clot that is already made, but it has to be caught early on to work. Okay, this is very fascinating and can be very confusing. So really try to wrap your head around this. This is important. Okay, so blood types and transfusions. Cells, blood cells, have cell markers on them. They have markers around the surface of the cell. And those identify what they are. Sometimes we have foreign antigens that are not found, they're not self. This is not my antigen. These are not from my body. They're foreign antigens. Self antigens are all over every cell membrane. They're little tags or triangles or markers on our cells. So self antigens don't cause us usually a problem. Antibodies, think of antibodies and antigens as two puzzle pieces that kind of fit together. So an antibody will react with an antigen and cause them to clump and stick together, and that's called agglutination. And when you have an antigen-antibody reaction, that's an immune response. So we have 50 different types of antigens, but we mainly focus on A antigen, B, R antigen. RH, I'm sorry, RH antigen. So selecting blood for a person needing a transfusion can be a matter of life and death, and you can't just randomly select. And I'll teach you how to understand this. Okay, so here are our blood cells. In this one, we have antigen A on it. This one, we have antigen B. This one is AB. And this one has nothing. Okay. Type O. O has neither, nothing on the surface, no antigens. So type A has A antigens. And in the plasma surrounding, remember 55% of the blood volume is plasma, and only a small percentage of the formed elements are red blood cells. But in the plasma, in that yellow straw-like fluid, we have antibodies floating around. So type A blood has anti-B antibodies. So it cannot have B. It has, if it discovers, if it tries to, we're going to have an agglutination problem. Type B has anti-A. Type AB, they have no antibodies, neither A or B in their blood. And type O has anti-A and anti-B. So it's the opposite. So agglutination can happen. So we have a person with type A blood here. A antibodies, no problem. Anti-B antibodies, and we might have a problem. And so what happens is the antibodies can stick to the antigens and cause agglutination, which looks like this under a microscope. Okay, so type A blood, let's get our head around this, has A antigens on its surface. 41% of Americans have this type blood. So A is itself antigen. Okay. So they have in the plasma anti-B. Okay. Type B has B antigens on the surface, and in their plasma, they have anti-A. Okay. Type AB has both on the surface, but has neither A or B antibodies in their plasma. So because they don't have any antibodies, they're considered the universal recipients. They can accept A blood or B blood or AB blood. So they're universal recipients because they can accept any kind of blood. Type O has no antigens, no A, no B on their surface, and their plasma has both A and B. So we call type O the universal donor, meaning they can give to anyone. Okay, here's a little picture here. So let's see here. Type O, let's start with type O. Type O in the blood has anti-A and anti-B. Okay. Type A has anti-B. Type B has anti-A. Type AB has all the antigens, A and B, so it has no antibodies in the blood. So type O person, so you don't want this clotting. You don't want this agglutination. Agglutinated blood is not good. So type O can only get type O. Type A can get O, which has no antibodies in the blood, or another person with type A blood. Type B person can get an O and also B. And type AB can get it's a universal recipient, so they can get anyone's blood. Okay, so you can kind of see here, AB can give to anyone, O can donate to anyone. Okay, so we mentioned the A, the B, the AB. Now you've heard of people saying, well, I'm A positive, or I'm O positive, or I'm O negative. RH factor is another antigen that we need to take into consideration. So this was first found in the blood of rhesus monkeys, and it was named the RH factor for rhesus monkey. RH factor is in 85% of white people in the United States and 88% of African Americans. So that's a large percent of people that have RH factor. So if you have RH factor, you have RH antigens. If you don't, you have none. You're considered RH negative. Okay. Okay, so where does this come into play? This is very important with a mother and a baby, mother and a fetus. Blood types compatibility. So an RH negative mother, if a woman has no RH negative antigen, no RH negative, no antigens on their cells, then it has to be concerned if the father or the baby is RH positive. So the first pregnancy, let's say this mom is RH negative, okay? Maternal circulation, you can see the cells here, okay? She has no antigens on her RH antigens, okay? Then but the baby does, okay? It was donated RH factor from the father and the baby is RH positive. Then the first pregnancy, the body will start to recognize, well, this is foreign. What's going on here? And after the baby is delivered, between pregnancies, the mother will create anti-RH antibodies. It didn't like that. What is that? That's foreign. There's an invasion. I don't like that. Okay. It's the second pregnancy you have to worry about. Because if that RH mother now has another RH positive child, her antibodies are going to attack the baby's blood. So that becomes an issue because we will have agglutination. So let me show you this again. You have an RH positive man. He's positive. She's negative. Okay. If you have an RH positive woman, you've got no problems. But if a woman is RH negative and the baby happens to get that RH positiveness or positivity from their father, now that baby is RH positive. Okay. The mother in the delivery, there's some cross mixing of blood. Okay. The mother will start to produce over here anti-RH antibodies. So now if she has another RH positive baby, her body and those antibodies will attack the fetal red blood cells. Okay. Now, there's a drug called Rogam that can be given to prevent this from happening in case of RH incompatibility. Here's a really nice way to memorize who can get what. So if you're positive, you can get positive or negative. If you're not, if you're negative, you cannot get positive blood. Okay? This is a nice little graphic. Okay, blood, remember, is connective tissue. And the amount of blood that we have in the body depends on your size, depends on your sex. But normally we have between 4 and 6 liters of blood. And that's about 8% of your total body weight. Blood has 3 important functions: transportation, usually oxygen, carbon dioxide, regulation, pH, temperature, all those things, and protection with our white blood cells. So transporting blood. Blood transports oxygen from the lungs, nutrients from the digestive system, fat cells, hormones, remember, with the endocrine glands. And then the waste products are carbon dioxide and other wastes that we remove with our kidneys, our lungs, any excretory organs. And then how is it a protective function? I mentioned the white blood cells are antibodies. It helps us protect against invasion. The regulatory role of blood, I mentioned pH. So it's going to always work towards homeostasis. So within normal parameters of cell functioning, we want pH to be between 7.35 and 7.45. Body temperature, it absorbs the heat, it spreads it throughout the body. Fluid balance. These are some tests for diagnostic tests. You don't need to know this for anything in this course, but if you are interested, we included these slides. Okay. I'm actually going to just double check here. I think that's all. Okay. Yes, we don't get into too many of the diseases, but these slides are available if it would be helpful to you, but you'll not be tested on pathophysiology. It's only the normal anatomy and physiology for this course.